Hi, I'm Carolyn Grimes with the Plastic Surgery Channel. We recently interviewed Dr. Jeffrey Keys, a double board-certified surgeon and a sought-after expert who teaches other surgeons about the latest nasal procedures. Take a look.
I'm Dr. Jeffrey Keys from Los Angeles, California, and I'm here to talk to you today about rhinoplasty. Rhinoplasty is one of the most important operations for improving the appearance of the face and has the most dramatic change on assimilating and blending the features of the face. When someone has a bump on their nose, or their tip is turned down, or their nose is too broad, or a number of different problems that sometimes occur with people's noses, the change that can be affected by rhinoplasty surgery is quite dramatic. When you decide to have a rhinoplasty procedure performed, what you can expect is, first of all, a comprehensive evaluation by the surgeon to make sure your health is in good shape and that you're able to undergo this type of a procedure. Most times the rhinoplasties are performed either under IV sedation, which means that they put a needle in your vein and sedate you and relax you so you're semi-awake but really you're kind of asleep, or they give you complete general endotracheal anesthesia, which means you're totally asleep. Most patients prefer to be totally asleep. It makes the procedure go very smoothly. There are two techniques of approach that are used for rhinoplasty. One is the closed approach and the other is the open approach. In the open approach, an incision is made in the columella, and once that incision has been made, the tissues are raised up and the operation is performed on the cartilages and bones in order to reset and improve the appearance of all of the structures. If a closed procedure is decided upon by your surgeon, then most of the surgery is done from within the nostril. This obviates the need for any scars, and many people like this approach. It all depends on the surgeon's capabilities and experience. The day of your surgery, when you appear at the surgery center, you'll be guided in by the nurse and instructed on the various post-operative situations that can occur so that whoever is taking care of you will be able to be most useful in your post-operative recovery. In surgery, generally speaking, the procedure can take from 1 to 3 hours depending upon which approach is used. After surgery, you'll have a recovery period at the facility, and then you go home with someone to watch over you for 24 hours. Whenever you have anesthesia, you can't be alone, so someone must assist you and come with you to surgery. You're certainly not able to drive that day, and the next day you come in for a checkup. The nose is cleaned, and you feel pretty good. There's not a lot of pain associated with rhinoplasty. Post-operatively, you can expect some bruising and swelling to occur, and usually there's a nasal cast on your nose. That's placed for about a week to keep swelling down and to keep the tissues in the proper position during the healing process. At the end of a week, when the cast comes off, your appearance will be markedly improved and you'll notice a difference immediately, but it won't be the final change. Swelling in rhinoplasty is persistent for some time, but most of the swelling will be noticed initially in the first week or two by you and the surgeon, and then after the first month or so, most of that swelling is not noticeable to your friends or you in particular, and the surgeon still is able to detect it. If a rhinoplasty is done properly, most people won't notice that you've had a change because they're not attuned to the way your nose looks. They're more worried about how their nose looks. So rhinoplasty is an excellent way of improving your appearance if there's something about your nose that bothers you, and you certainly should seek a specialist for a consultation to determine if you're a good candidate. I'm Dr. Jeffrey Keys, and you're watching the Plastic Surgery Channel.